Menopause affects all women and symptoms can vary, but did you know it can affect a woman's heart if it hits too early? Coming up, meet a woman and her doctor who took extra precautions to lower her heart risks. Good morning. It is Thursday, December 15th. I'm Jessica Lovell. Welcome to the Morning Medical Update. We are live inside the Dulcie Simons Jr. Family Broadcast Studio. Women who go into early menopause are twice as likely to suffer from heart disease and stroke. Today, we find out why and what you can do to prevent it. So make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right here on your screen. But first, we are making our morning rounds. Sports reporter and Kansas native Grant Wahl collapsed and died while covering the World Cup last week. We now know why. He died of an aortic aneurysm. Each year, about 15,000 people in the U.S. die from a ruptured aortic aneurysm, and they are the 10th leading cause of death for men over the age of 50. Grant Wahl was 49 years old. We are joined by thoracic surgeon Dr. Peter Downey. Dr. Downey, good morning to you.
Good morning.
Good to have you. Thanks for being here to talk about this. Wahl's autopsy found it was a slow-growing aortic aneurysm with hemopericardium. Am I saying that correctly?
Hemopericardium.
Okay, so tell us what that is.
So the heart's a hollow muscle. It pumps blood out to the body out this main pipe called the aorta. The aortic aneurysm is a expansion of that main pipe. That puts it at risk for tearing, which can lead to leaking of blood outside the aorta into the heart sac. Blood in the heart sac, but around the heart, is called hemopericardium. So
they said that it was slow growing. How long could he have had that aneurysm? Would he have even known it?
We don't know. It's hard to know unless he had imaging that was done years before. The aneurysm can grow slowly over a couple years, or it can grow rapidly. But in this situation where it happens emergently, it's impossible to know how fast it grew.
Really, really scary. So how are they diagnosed, and are there warning signs that someone should look for?
So aneurysm is most commonly picked up on imaging that's done for other reasons. So if the patient has an x-ray, or if they get a CAT scan or an ultrasound, you can see it kind of incidentally, and the radiologists here are very good at picking up an aneurysm if they're looking for something else. Unfortunately, there's no clear-cut screening tests that can be done for thoracic aortic aneurysms.
So it ruptured. We hear that this ruptured. Once it ruptures, is it just too late, or is there a way to treat the rupture?
There is a way to treat, but that's blood leaking out the main pipe going to the rest of the body, and the concern is that you only have a few minutes sometimes. The treatment for that is an open heart surgery, but really a patient needs to be already in the hospital at the time of rupture for the best chance of success with surgery.
And who's at risk for this? We said men over the age of 50, at 10th leading cause of death. Why is that? Why men? And why is it age? Is it family history of heart issues? What might it be?
Risk factors for aneurysm. The most common risk factors are high blood pressure, cigarette smoking, and they often run in families. So anyone who's had a relative, especially within their immediate family, is at a significantly increased risk for developing the aneurysm. Once the aneurysm develops, the risk of rupture goes significantly up.
So in the days right before his death, he reported feeling not well, tightness in his chest. He had been treated for bronchitis. Could they have caught this earlier? Is there something that could have been done before it ruptured?
It's hard to know if they could have caught it earlier or if he also had bronchitis. If they had gotten a scan and seen the aneurysm while he was still stable and his blood pressure was okay, there's a very good chance he could have been treated. It would have required open heart surgery, but before it ruptured, they potentially could have offered that to him.
It's just such an unfortunate story. So sad. He's so young, and one of our Kansas guys. So, Dr. Downey, thanks for being here this morning and just kind of helping us better understand exactly what that is.
Thanks for having me.
Thank you. And tomorrow we're going to hear from a patient who had an aortic aneurysm and survived it. We'll discuss how it was identified and, most importantly, how it was treated. Menopause is defined as the time when a woman's ovaries stop producing hormones and menstruation stops. For most women, it happens in their 50s, but for that 5% who experience early menopause, it comes with risks of serious complications. The woman you're about to meet is doing what she can to avoid those risks as she travels through the journey of menopause, especially knowing her family history with heart disease.
Amy Franken's in a good place. She has 2 beautiful sons, all grown up now.
So this is Cole. He is 27. This other one is our youngest, Alexander.
She has a husband she adores, a dad she loves looking after,
I have a 92-year-old father that I currently take care of.
and a sweet senior cat.
She thinks we can't see her if she's under the table.
Her life is full,
I mean, I feel healthier now than I have when I was 20.
and that's quite a statement considering what she recently endured.
Radical hysterectomy, which included removal of everything except ovaries, a prolapse repair, and a bladder sling, all in one surgery.
All Amy says courtesy of those back-to-back baby boys she gave birth to decades ago. The most worrisome being her prolapsed uterus, meaning her uterus had slipped out of place.
I had almost a 10-pound baby and then 12 months later a 9-pound baby. So I knew my pelvic floor was compromised because of that.
And in 2021, after enduring a slew of painful and uncomfortable symptoms, that's how she came to meet the University of Kansas Health System OBGYN, Dr. Melanie Meister.
She's wonderful.
After the surgery, Amy felt great physically, but it was the emotional part of menopause she wasn't quite ready for.
And there's some depression that goes with that, and some anxiety, and some, what does this mean for my life now? And, you know, there's a lot of things to think about that you weren't really prepared for sometimes.
However, Amy is prepared for the increased cardiovascular risks that doctors say can come with menopause and early menopause, particularly knowing her own family history.
On my mother's side, all of the grandparents have died in their 50s of heart disease. Almost everyone has had a heart attack, has had heart disease, has had a high blood pressure.
In her 50s now, Amy is taking her health seriously, working diligently with her doctors to monitor for any signs of heart trouble. And she has no intentions of slowing down, planning decades more of adventures and travel. In the meantime, she has a message for other women.
I think it's okay to ask for help, and it's okay to reach out, to not kind of suffer in silence.
And we are pleased to have Amy joining us this morning, along with her OBGYN, Dr. Melanie Meister. How are you?
Good.
Good to see you, Amy. Thank you so much for being with us. Since we last spoke with you, has anything changed with your health? How are you feeling?
I feel great. Nothing has changed. I'm still on the estrogen patch, and it's working great.
So let's talk about your symptoms. What ultimately sent you in search of Dr. Meister? What were you experiencing, and then what were you able to share when you finally found her?
Sure. Predominantly, it was abdominal pain. I've had some issues with ovarian cysts in the past and different pain issues, and so she dealt with that. But predominantly, it was a prolapse. Where my uterus had slipped out of place, and that needed to be repaired. And then in conjunction with that, we did a bladder sling for some bladder incontinence.
So Dr. Meister, why did you recommend Amy have a total hysterectomy? What is that, and why would someone need that?
So when we talk about a total hysterectomy, generally that involves removal of the uterus and the cervix. Often we also recommend removal of the fallopian tubes as well. In Amy's case, I recommended a hysterectomy as a management strategy for her uterovaginal prolapse. So as Amy said, her uterus had slipped out of place, it had begun to descend within the vagina, and ultimately she had started to have some bulging outside of the vagina. One management option for that is surgery, and with surgery we have to reattach the top of the vagina back up to some ligaments in the pelvis. That usually involves a hysterectomy.
Is this painful?
It can be painful. Commonly, the most common symptom is a sensation or a feeling of pressure within the vagina or bulging actually outside of the vagina, but it can be associated with pain or heaviness too.
So why do women going through early menopause have a risk of heart complications? Let's talk about that. Let's make that heart connection, because that is concerning.
It is concerning, and you know, there are a lot of changes, physiologic changes that happen with menopause that increase cardiovascular risk, and we don't actually understand everything, but we do know with the hormonal changes, specifically decreasing estrogen, there are changes in the lipid profile, so there's an increase in total cholesterol as well as LDL, or sometimes called the bad cholesterol. There are also some vascular changes within the blood vessel that increase atherosclerosis. And then metabolic syndrome, the constellation of high blood pressure and high cholesterol and central adiposity or obesity is more prevalent in the postmenopausal population. And when women experience menopause early, so before age 45 or before age 40, they seem to be at even increased higher risk.
And are all women who experience early menopause at risk, or just somebody who has a heart risk already?
Everybody is at risk after menopause, and like I said, the women who experience menopause even earlier seem to be at higher risk. Those women with a baseline increased risk of cardiovascular disease because of a family history or some other conditions seem to be at even higher risk.
So menopause overall puts you at a higher heart risk. Is that why we talk about women, being plagued by a heart disease and having heart complications and being the #1 killer of women? Can it go back to the fact that you're getting into your 50s and you're going through menopause?
It can be linked to that. That's not the only reason, but certainly it is emerging as an important risk factor for women.
Okay, now this is an asking for a friend moment. What is early menopause, and what's the difference between like perimenopause and early menopause or premenopause?
Those are good questions. We have lots of different terms. Menopause is, we define that by 12 months of no menstrual periods. And for most women in the United States, the average age of that is 51. We consider menopause to be early when it occurs before age 45, and we consider it to be premature if it occurs before age 40. So that's, again, 12 months with no periods occurring before age 40 or 45.
So the 12 months, okay, so go back to that, because I've had friends who have said that they haven't had one for 12 months, but then all of a sudden they have it again. So they have other issues going on is that the only definer, just not having them for 12 months? That means you are officially in menopause?
That is the criteria that we use to define. Now, that said, there are a lot of symptoms that go along with menopause, including hot flashes, night sweats, irritability, some mood changes.
Oh, I have no idea what you're talking about.
Right. Those can occur for months or even years before that last period, and can actually even extend for months or years after that last period.
Okay, Amy, did you have any family risk of heart disease already, even with the early menopause? So tell us a little bit about the family history there.
Yes, I have grandparents and really family members on both sides who have heart disease, high cholesterol, and high blood pressure issues. So I've been sensitive to that since I've been in my 20s.
So you've always had that in your head and your thoughts. And did it change the way you lived, your lifestyle choices, and just taking good care of yourself?
Yes. In addition to the heart disease, about 4 years ago, my family medicine doctor at KU, Mark Meyer, diagnosed me with type 2 diabetes, and I am not your typical patient to be diabetic, and so mine was genetically linked through a grandfather. So I really started monitoring my diet very carefully, really cutting back sweets, sugars, carbs, and I stopped drinking alcohol, which was a big issue that needed to be dealt with as far as weight management and for diabetes.
Well, good for you. Good. You're being a good patient, and that's really hard to do. You cut all the good stuff out, Amy.
Right? Yes.
And how are you feeling?
Right now, I feel great. Like I said in my piece, I really never felt better. Really, I feel excellent.
So, Dr. Meister, how do you check on Amy to make sure she's doing well? Is it blood check, blood works? How often do you have to see her, and what's next?
So I have been managing her menopausal hormone replacement therapy along with her primary care doctor, and Amy's really fortunate to have a really great primary care doctor who is following the screening that she needs for her other health, including her cholesterol and her thyroid and, as she mentioned, her diabetes. That is really the important thing, is making sure that patients are up to date and consistent with the screening that needs to happen periodically, particularly after menopause. And then we check in periodically about her symptoms, making sure that her hormone therapy is adequately controlling those symptoms. And we talk about how long to continue that and when we should talk about decreasing it.
So you talked about collaborating with and communicating with primary care doctors. What about our heart team here? We have a very robust heart program. So how are you talking with them when you have a patient like Amy?
If I have a patient who is identified as being at risk of cardiovascular disease, I do get them plugged in with the Women's Heart Center, which is, as you said, a very robust and great program that we're really fortunate to have here. Like I said, I try to identify any particular risk factors and then refer them over if needed.
That's so interesting. I'm learning. I learn something here every day. Go figure. But just that connection between heart and menopause. So interesting. Okay. Is it something we should be concerned about? Is that something to be now on the radar for women as they head into those years, get to be 50, we know that's on the horizon. And then is that something they should be checking in with their doctor and asking questions about and really understanding their heart family history?
Absolutely. It's very important to understand family history. And then, as Amy mentioned and highlighted nicely, those other lifestyle changes become very important, particularly as we enter a time when we're at higher risk of things like cardiovascular disease. But exercise, diet, making sure we're cutting back on things that are not good, like alcohol, but in particular smoking and weight loss can also be an important lifestyle change.
Not easy to do, but
No.
it's so good to hear that Amy did it and is feeling the benefits.
Right.
I want to put a QR code up on our screen right now. You can scan it to find out more information about our women's heart care and our menopause teams and get more information about what we're talking about. I want to take a quick check-in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us virtually this morning with an update on our numbers. Good morning. How are you?
Hi, I'm good. I hope everything's good there.
It is.
I did travel yesterday. I did wear my mask. I saw probably maybe 1% to 3% of people in the airport and the plane wearing their masks, which is good, both older and younger patients. So again, I think it's very important coming up, especially for holiday travel season, to continue to those things to reduce your risk of getting infected, but also being ill, and being ill when you are at your destination, but also maybe transmitting it to others who may be at more risk as well. So as far as the COVID numbers today, we are still seeing high amounts, 50 total, but our actives down just a little bit, 29 active, unfortunately still 4 in the ICU and 2 on the ventilator as well.
All right, Hawk, we're seeing more cases of strep A. It killed 13 children in England. Why are cases going up? That sounds really alarming to me.
Yeah, so group A strep, or strep A, strep pyogenes, is a serious bacterial infection. We do have very active antibiotics against this bacteria, but it can cause an infection, and that infection can move very rapidly. Certainly, we know that in some cases in the hospital, for instance, if you had a surgery and we detect a post-operative infection after your surgery, even one case is considered an outbreak that needs to be investigated. So it is not treated lightly because we know the devastation this bacteria can cause. I know that we talk a lot about our viral illnesses with COVID-19 and influenza, but this is a bacterial illness. This is actually an illness where antibiotics can be used to treat. But in some cases, you also need to use surgery for things like those necrotizing infections. We've heard about flesh-eating bacteria. This is one type that can cause serious damage to your skin and soft tissues. So it is not treated lightly. It is treated aggressively with antibiotics and also sometimes surgery. And we need to be on the lookout. This is something we do see in our patients on a regular basis, not only here at our health system, but really around the nation. But when you do have clusters, those definitely need to be investigated to make sure there isn't a common source or something else is going on.
Doc Hawk, demand for antivirals is high across the U.S. as flu cases, as we know, are going up. What are flu antivirals and how do they help?
Yeah, so for influenza, there are a few antivirals that are used. The most common is Tamiflu or Tamiflu, or the generic is called oseltamivir. There is a shortage of that going on in the United States right now. I was able to just talk with one of our infectious disease pharmacists, Eric Gregory, today. We do have a fairly good supply here at the health system, both on the inpatient and outpatient basis, but we are being stretched. So we need to know to understand to give that to those patients that are highest risk. There are also 2 or 3 other antivirals available, but those are in less widespread use. But overall, we know that the antivirals are important, especially if you are at high risk of hospitalization and severe disease. Getting on those antivirals can reduce your risk of going to the hospital. They can also help reduce the days of symptoms by about 1 to 2 days, especially in those patients who are not at higher risk. But we really need to focus on, just as with SARS-CoV-2, those patients that are at highest risk of hospitalization and severe outcomes, and really get those patients tested early and if positive for influenza, get them on the antiviral to help to reduce those risks.
Doc Hawk, thanks so much. Do we have any reporters on the line today? Let's get to our community. Angela has a question, Dr. Meister. She said, I had a quadruple bypass in 2019, had been out on bioidentical HRT.
Hormone replacement therapy.
Thank you. My doc took me off that, had prolapse surgery in 2021. I'm a mess hormonally. Why don't they have anything to help us women? Quality of life. What can they do for women just to help with that?
So she mentioned a lot of quality of life issues in that question, and I would say that there are a number of things that we can do. Hormone replacement therapy is one option, but for some women that's not a good option. For some women that's not a safe choice, and there are some non-hormonal medications, but there are also some lifestyle things that we discuss. So dressing in layers is one for women with hot flashes. Keeping a fan close by, which sounds maybe burdensome, but can be helpful, particularly for those acute symptoms of hot flashes. But I would say I would encourage her really to reach out to her doctor and talk, because it sounds like that she has a number of quality of life conditions that could potentially be addressed in non-hormonal ways.
Yen Liang asks, statement, it's reported that an adrenal gland could provide women with a small amount of estrogen that could help women to get through the difficulties after menopause. Is that correct?
So the bulk of our hormonal production in terms of estrogen and progesterone come from the ovaries, and there is a great succession in that amount of hormone production that happens with menopause. But there are some sort of other ways that we get low levels of hormone production from our bodies. The adrenal glands do produce hormones, not generally estrogen and progesterone, but some adrenal hormones that can help with some of those symptoms. But unfortunately, the ovaries are the main producers of the estrogen and progesterone.
So just because you are low on estrogen doesn't mean you should be on hormone replacement therapy.
Right.
There are other factors, so that's not the go-to.
Well, there are. So hormone replacement therapy is really intended for women who are having hot flashes, night sweats, some of those what we call vasomotor symptoms of menopause. Hormone replacement therapy is also helpful for bone health and prevention of osteoporosis in postmenopausal women. There are other conditions that hormone replacement therapy can help with, but it's not necessarily indicated for.
So what are the downsides of it? Because everything you just mentioned sound like a lot of upsides.
Sure. So there are, as I mentioned, there are some people who cannot take hormone replacement therapy. Those are people with a history of blood clots or a history of stroke, liver disease, or estrogen-sensitive cancers like endometrial cancer or breast cancer. Those women cannot use hormone therapy. Other downsides, we know with prolonged use, there are some risks. So risks of blood clots, risk of stroke, and with certain certain hormone therapies, if it's not done correctly, there is risk of cancer like endometrial cancer.
So, Amy, did you have symptoms, menopause symptoms? What were they, and how bad were they, or were they pretty mild?
I would say they were in between, harsh and mild. I definitely had the night sweats, definitely had some irritability, and definitely dealt with just the traditional symptoms that Dr. Meister just described. Our choice was to go on hormone replacement therapy after my hysterectomy. We did leave my ovaries, so there is some estrogen production there. I went on the patch and started at the lowest possible dose, had a little bit of breakthrough symptoms, so we went one step up, and that is just working beautifully. I'm having no symptoms at all, no hot flashes, no irritability, no night sweats. It seems to have really worked.
Ooh, that sounds really nice. Nancy wants to know, Dr. Meister, and you may have mentioned it, but do hormones play a direct role in the heart health for women?
Yeah, we think they do. So with the decrease in estrogen, as I mentioned, there is an increase in total cholesterol and that bad cholesterol. And there are also some vascular changes that can increase cardiovascular risk. And that is linked to the decrease in estrogen and progesterone, probably among some other things as well.
Sure. And elaborate on this, because Kim wants to know, when should you go see a doctor for your menopause symptoms? Are you doing it because it's uncomfortable, or is there ever a time when you're like, I need actual deeper help here?
So certainly anytime you're concerned or have questions about it, that's a great time to talk to your doctor. Lots of times it is the menopause symptoms themselves causing those hot flashes, night sweats, but there can be other medical conditions that can be causing symptoms like that as well, particularly thyroid dysfunction, can mimic some symptoms of menopause. And so it would be important to talk to your doctor to make sure there's not something else going on that could be treated differently.
Question, how effective are over-the-counter supplements and estrogen and things like that to help with some of that? Does it help a little? Should you check and see if that works first, and when it doesn't, then maybe pick up the phone and call you? What are you finding out or hearing?
So some of those over-the-counter products are hard to comment on, mostly because they're not studied very well and they're not FDA regulated, and so it's hard to know how one will affect another, and you know, if you're getting the same amount or type of hormone in one as another. So really, it's best to talk to your doctor, and if you're considering hormone replacement therapy, really to go through the pharmacologic route.
Well, because it's one size fits all over the counter. This is something that would look right into you. You're going to do the blood work, and you're going to find out exactly how much you need of different hormones, correct?
Right, and as Amy mentioned, that's typically our approach. We start low and can increase as needed if the symptoms aren't controlled, and then we have an ongoing discussion about how long to continue therapy and when to talk about stopping.
Okay, so Abby wanted to know if there's any medications that you can take on your own for menopause, but so you're thinking, no, I mean, you could try it, but don't rely on it.
Right, I would talk to your doctor.
Good idea. Good, I knew you'd say that. Lisa wants to know, when do you know you have officially reached postmenopause? And what's it supposed to feel like after you do?
Oh,
Are you supposed to feel amazing?
It can feel different for everyone.
Okay.
You know, the technical answer is you have officially reached postmenopause when you've gone 12 full months without having a period.
Okay.
Now, as I said before, those symptoms, the hot flashes, night sweats, irritability, moodiness, that can linger for months or years even after that.
Before and after.
Before and after, right.
Okay.
So there's not a great way to know until it's done to know that those symptoms are resolved, unfortunately.
Okay, because then Carolyn, next question, wanted to know why she's still having hot flashes years after going through menopause. So that's why. They're there. Will they ever go away?
They usually do. There's been some data that a low percentage of women, even into their 80s, experience those symptoms. But the vast majority of women have symptoms for about 7 years, front and back total. Okay. And then they resolve. Eventually.
Not completely the news I wanted to hear.
I know, unfortunately.
But good information nonetheless. Make sure we don't have any other additional questions. Oh, Joellen has one. Is hormone replacement therapy synthetic now? She said hated the idea of Premarin with the horse industry. Tell me about that.
Premarin is there's a variety of hormone formulations available. Premarin was originally or is synthesized from horse product, but there are synthetic hormones that have been found to be safe and effective. So again, I would talk to your doctor because there are a number of different formulations available.
Okay. So doctor, not Google.
Yes, that would be my general recommendation.
Okay, good stuff. All right, I want to get to our final thoughts. Good conversation. We could go to coffee and talk for hours. Yeah. I love it. Okay, so let's start with you, Amy. Final thoughts, and just what do you want us to know about just kind of putting our health first, and as women, asking all the right questions?
Right. Well, I think first of all, it's really important to have some continuity of care, as Dr. Meister has talked about. So for me, that's been having an excellent family medicine doctor who manages all aspects of my care. Mm-hmm. So he's involved with blood work and high blood pressure and cholesterol and my thyroid issues and everything. So I'm not seeing specialist. I'm seeing one person to manage all of those things and reaching out to the specialist as I need them, which we did in the case with Dr. Meister. We knew that I had a prolapse and we needed to go that route. So, and it's asking for help, and it's not suffering in silence. I think a lot of women are embarrassed about their symptoms, are uncomfortable about discussing them, and to Dr. Meister's credit, she's just very easy to talk to work with. She's very available. Her nursing staff is available so that you feel comfortable asking for help when you need it. And I think that's something that a lot of menopausal women are not comfortable with.
Well, they're not, and I appreciate you coming forward and sharing your story. It's a really interesting case, and you help our patients help every time they come on here and kind of give a face to different types of things that are going on with our bodies and things that aren't always easy to talk about. So, Amy, thank you so much, and please be well.
Thank you.
Dr. Meister, final thoughts from you today.
So I would say, again, menopause is technically defined as that 12 months with no period, but those symptoms can last for several months or years on either side. And it's important to talk to your doctor because along with menopause comes an increased risk of multiple conditions, but notably cardiovascular disease. And there are some lifestyle modifications that you can make to decrease your risk.
Early, too, right?
Correct, right, early.
Earlier than later. Dr. Hawkinson, final thoughts from you today.
Yeah, I just want to say thank you to our guests, helping to create open, clear conversations about an issue that affects so many women around the nation, around the world. So thank you. And also, again, remember to get vaccinated for influenza. There is still time. It is always the right time to do it. If you are infected or you have symptoms, please go get tested so that you can get on early antiviral therapy, especially if you are in that high-risk category of hospitalization. It will help reduce your chance of hospitalization. And importantly, if you have been infected, it is vitally important to get vaccinated for influenza because we know that there are multiple circulating strains throughout the year, and you can still be reinfected with a different strain. So,
Doc Hawk, thanks for being with us today. Safe travels back to Kansas City.
Thank you.
All Things Heart is coming up at 10 a.m. Host Alexis Del Cid joins us now with a preview of today's program. And Alexis, I have to say, before we get to this story, you had done the story with Amy, and I'm just so fascinated and just it's something I'd never heard of, and it makes me think twice when it comes to getting into that time of life and our heart health. So gosh, it's like...
And hats off to Amy for being so willing to share her journey with us, because it's so helpful to the rest of us we're all going to travel that same path. And she was able to explain it so clearly and share her story. And I just love that she was so open, because it's going to help so many women.
Absolutely. All right. What do we got coming up at 10?
So coming up at 10 a.m. this morning, a Kansas City woman goes to her appointment with her primary care physician, and it's a good thing she does.
Dr. Poley early on described me as a stroke waiting to happen.
A stroke waiting to happen. How terrifying would that be to hear? This woman could be any of us, but what she did next and how that doctor helped her is nothing short of incredible. And part of her inspiration, President Dwight D. Eisenhower, who was a fellow Kansan. So tune in at 10 a.m. this morning to watch and join the discussion, and bring your questions. We will answer them all.
All right, Alexis will be there. Thanks so much. And thank you all for being with us today. You can catch our updates anytime by logging back on to Facebook, YouTube, and Twitter. Go out, make it a great day, and we'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, she's a nationally acclaimed artist who created some special pieces to say thank you to the healthcare team who she credits for saving her life. I'm Jessica Lovell on the next Morning Medical Update. Irma Starr shares her story of being diagnosed with an aneurysm in her heart. Making matters worse, she came down with COVID the day of her surgery. We meet her, her team, and the gratitude behind these little guys. We want to let you know that starting next week, we will be taking a couple of weeks off from our program so that we can spend some time with our families.
The good news is you'll still be able to watch our Morning Medical Update every weekday and All Things Heart on Thursdays.
That's right. We have chosen some of our very favorite episodes from the last year as encores, and we've recorded some pretty fun introductions to help remind you what each of those episodes is about. Wait until you see how many ugly Christmas sweaters Dr. Stites and Dr. Hawkinson own. Very interesting.
I can't wait. And then we return with live programming on Wednesday, January 4th. Until then, happy holidays.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.